Welcome to the Fertility Minute with Dr. Mo. I am Dr. Maureen Schulte, or Dr. Mo, and today we are discussing the novel coronavirus and its impact on fertility patients and their treatment. This is a very uncertain time for all of us, so my goal today is to present the data that we do have and what we and other fertility clinics across the country are doing at this time point. So today, SIRM St. Louis is following all CDC guidelines and patients are still undergoing treatment. We are practicing social distancing and limiting the number of patients and people in our clinic. We have switched to telemedicine consults, are practicing hand washing per usual, and are practicing Clorox wiping as usual after every patient, and social distancing as much as possible. What we know about the novel coronavirus in pregnant women and in pregnancy is very limited. We have limited data of studying this disease in pregnant women and their offspring. There are no strong indications of negative effects. However, again, the data is limited. So when we extrapolate data from other viral infections in pregnancy that are similar to coronavirus, we know that pregnant women are at increased risk of miscarriage, of intrauterine growth restriction of their babies, and of potentially preterm birth. So therefore, in Europe, the European Society for Human Reproduction and Embryology has recently recommended that fertility patients defer pregnancy at this time. Recently, American Society for Reproductive Medicine has created a task force and has brought together a panel of experts to review the data in order to make recommendations to guide American fertility specialists on best practices for our patients. So we are eagerly awaiting those recommendations, but in the meantime, fertility clinics across the country are again practicing CDC guidelines and having frank discussions with their patients about the impact of coronavirus in pregnancy, again, which is limited, and potentially freezing embryos or freezing eggs and deferring embryo transfer.